Please welcome Dr. Paddy Jim Baggot.
Okay, they said imitation is the sincerest form of flattery. So I was honored to hear the talk from Phyllis Schlafly where she introduced her family members, and I'm here with my sister Rosie, my sister Kathleen is back there, and Rosie's daughters are also here, including Veronica. Okay, so my talk is doubling the rate of neurologic development in Down syndrome before and after treatment with the Institutes for the Achievement of Human Potential. This group is in Philadelphia. There was a guy called Glenn Doman who was a decorated military hero in World War II, and he started the Institutes for the Achievement of Human Potential, treating children with neurologic disabilities such as Down syndrome, CP, autism, learning problems, and brain trauma. He published an article in JAMA in 1960 that his treatment would have a significant effect on development. And one of the things in the original article was patterning. And patterning has become an obsession with critics, but actually patterning is merely teaching someone how something feels. So if your child has a pen in their hand and you move their hand to help them draw, that's patterning. Or it's the sensory side of a motor experience. Or similarly, if you teach your child how to ride a bike by holding the bike up and moving along so they can see how it feels, that's patterning. However, Glenn Doman was far ahead of his time, and he evoked a counter-revolution. So we'll get to that a little bit later, but let me briefly discuss what the program is. As he would have said, the brain grows by use. So just like if you lift weights, your muscles will grow. If you use your brain will grow. There is sensory stimulation in the program with increased frequency, intensity, and duration, and motor opportunity. And there's a biochemical aspect, so we want to provide an excellent environment for the brain development. And key is that the parents are the best teachers or therapists. So the program should include a physical component, a physiologic component, an intellectual program, and a social program. The sensory stimulation is visual, auditory, and tactile. And mobility or motor begins with crawling and then creeping. Crawling, in their terminology, is crawling with your stomach in contact with the floor, which doesn't require balance. And creeping, what they mean is crawling with on your hands and knees, you're not in contact with the floor. Walking and running. Nutrition is important, detoxification is important, oxygen is important. The intellectual program includes reading, mathematics, and encyclopedic knowledge. It's done mostly at home, it's done daily, and it's done with and by the parents. And I met one mother and interviewed her extensively, and here's what she told me. She gave up her prior career. She travels from the other side of the world. She does the program with her child 6 hours a day. This mother has a child with Down syndrome. And her child is in normal, regular school and is indistinguishable from other children in that school. Now, as I said, Glenn Doman's article in the JAMA of 1960 evoked a reaction, you could say, which was a very negative reaction. The pediatricians published a committee opinion stating that no significant improvement is possible, that the regimen is too demanding, that it claims to cure incurable conditions. It claims normal children can be superior. And maybe this is the telling point. Opinions greatly exceeded data, and there was a proliferation of society and committee opinions that vastly exceeded the data. And these opinions have not been revised at all since 1968. Back in that era, there were both positive articles and negative articles, but since that, and most of the negatives, this guy would produce one study of data and then 3 or 4 opinions, and similar here. Oftentimes, they didn't really understand or replicate the method correctly. Now, since 1960, there have been a number of paradigm shifts. Now, think about 1960, that's a heck of a long time ago. Things were very different in that era. In that era, we were told that neuro problems, genetic problems, congenital, they're all untreatable. There are no treatments. Later, human and animal data, in fact, treatments are possible for such treatments. Back in those days, brain disorders were considered primarily psychologic or subjective. But now, the brain pathology and neurotransmitter pathology is known, and in fact, there are drugs for psychiatric and neurologic conditions. So we would frequently use drugs for depression, but back in the era, they would think that didn't make sense. It does require, this method does require extra effort. If we would say that a child has an IQ of 20, what that means is that in 5 months, the child makes 1 month progress, or 20%. That's what an IQ means. That's what the IQ means. However, what would happen if such a child would have 5 months of training in a single month? Then maybe it could keep up. And in fact, improvement without some sort of training and education would be irrational. So one of the negative studies, this study, a group of people with IQs less than 20, and they're only treating them 2 hours a day. If your child is in school, your child gets 6 to 8 hours of education and is just keeping up. A child with an IQ of 20, 2 hours a day would make no difference. And on the other end, imagine I would say that I have 2 skaters. One is a completely normal skater, and one is an Olympic champion. Which one trained from an early age? Which one trained 6 hours a day? We all know the answer to that question. And if I would change skating with any other sport, we all know the answer. In fact, there's a population-wide experience. Not so long ago, the vast majority of the population was illiterate. What changed that? What changed that was we now have public education. Every child is expected to get 6 to 8 hours of normal school and do that for a minimum of 10 years. And the result of that is that we go from a population which is illiterate to a population which is literate. So, in fact, it's not that different from your common sense. And, of course, early significant training will make a difference. Now, there was tremendous disbelief when these ideas came out. And those who are disbelieving try to throw obstacles in front of it. So they said that this developmental profile, that no basis for it was ever published. Actually, in these articles and books, it was published, and it was never validated. Now, think about this. When have you ever read an article in a scientific journal, and it says, the one group of uteruses weighed 600 grams and the other weighed 300 grams, and the scale was validated? You've never seen that in any scientific journal, right? Okay, so, and also, the disbelievers think it's all purely subjective. However, if you're a child trying to walk across a room, you will either maintain your balance or you'll fall on your face. That's not subjective. And in fact, the Institute's profile is the oldest neurologic measurement tool, beginning in 1961. Now, after Glenn Doman, animal studies by these authors and others proved that IQ can improve, and that normal brains with various types of early extra stimulation can be superior. 5 human studies have shown that IQ could be increased by 10 to 20 points. So in humans and animals, this has been shown to happen, although later than Glenn Doman. And in fact, remember, in this era, most children with these problems were institutionalized. It would have agreed with what Glenn Doman said, that now all these children are de-institutionalized and they would get better care at home from their parents. And now the American Academy of Pediatrics recommends reading to children right from birth, following Glenn Doman. And so here I would say that imitation is the sincerest form of flattery. There's only one recent study by this guy called von Tetzchner, and he parrots the same usual stuff, that claims of superiority of this treatment are not supported, that it's too demanding, that you would have to do 30-minute treatments per day. Is that realistic? How could anyone do 30-minute treatments a day? That it requires increased effort for no gain. Is this realistic? If you were doing a substantial amount of training, we're saying that would make no difference? Is that realistic, or is that magical thinking? And that also consistent with all the other detractors, that standard treatment is actually better than no treatment. Flaws of this study. They recruited 35. However, about half the parents quit. I think the parents thought that this was a study that was being done to criticize the institutes. So imagine the parents with the best results quit the study. I wonder if that would have an effect on the study. Now imagine here we're going to do a study with 18 in one group and 17 in another group. And among these, there are 13 different developmental tests done. Imagine what that would do to the variance of your study. If you would take any 2 randomly from each group, they'd have different exams. And these are the diagnoses. There were 5 with genetics, say, in each group. Well, this is an overly broad category. If you have Turner syndrome, you have normal intelligence. If you have trisomy 13, you have profound mental retardation. So this study, one could say that there's so much variability, how could you come to much of a conclusion? And actually, there were some parts of this study did have statistically significant. The only parts of this study that were statistically significant were that the parents thought that this treatment was much better than the standard treatment. And reading between the lines, you could see the parents were kind of angry at not being told about this earlier. So now, let's stop whining and design a better study. So now we're going to reduce variability. There's only one diagnosis. Reduce variability. There's only one developmental exam. The same exam before and after. Each child serves as its own control. And then we're going to look at the slope of development over time. That's what's important. That's what an IQ is, the slope of development over time. And we're going to compare before and after. Now, this is a before and after study. It's not a long-term study. This is a 25-year longitudinal cohort, 248 children, 24 were lost to follow-up, and a few others had data problems, which comes down to 216. So overall, very good follow-up. So at each point, there will be a neurologic age and a chronologic age. In normal development, the neurologic age and the chronologic age should proceed at the same rate. and in that case, the ratio would be 1. If you multiply it by 100, then you'll get an intelligence quotient, or earlier, a developmental quotient. So if a 2-year-old can do 4-year-old skills, then the neurologic age is 4, the chronologic age is 2, multiply it by 100, that's 200. So that's a child with the IQ of 200. If some brain injury caused slowing of development, if the child's neurologic age if the neurologic age over the chronologic age is only half what it should be, or 0.5, multiply that by 100, that would be an IQ of 50. So that's pretty much what we would have in Down syndrome. And for the purposes of this talk, intellectual quotient, developmental quotient are considered clinically equivalent in this talk. Okay, now let's imagine we're going to do a study measuring an improvement in this quantity. So if at 6 months a child has 3-month skills, then the IQ equals developmental quotient is going to be 50. It's making half as much progress as it should be making. If the child were then to make 9 months of progress in the next 6 months, then the change in the neurologic age over chronologic age would be 9 over 6 times 100, 150. So for the first 6 months, the child has an IQ of 50. For the second 6 months, an IQ of 150. And at the end of the time, the child would have spent 6 months at 0.5 and 6 months at 1.5, and would finally have made 12 months of progress in a period of 12 months, and then would have an IQ of 100. So when the patient makes rapid progress with the introduction of a new treatment, that's called catch-up recovery. So if you started off with an IQ of something quite low and you made catch-up recovery, at the end you might be a relatively normal as opposed to advanced. All right, now I'm going to show you some graphs, and I'm going to show you how I make the calculations in these graphs. So the initial neurologic age in example 1 was about 7.89. The chronologic age is 12.96. That ratio is 0.61. So the before IQ is 0.61. The date of the first follow-up, the child at that point has made neurologic age of 21, chronologic age is 20. The difference in neurologic age is 21 minus 7.89, that's 13. The difference in chronologic age is 20 minus 12 is 7.5. The slope of that change is 13 over 7, or 1.75. So for the period of time right after the change, the child was making rapid progress. And then at the end of that time, after a period of time, very slow progress, and a period of time, very rapid progress is normal. And in the end, this child had an IQ at 80 months of 71. So if 70 would be the borderline between mild mental retardation and normality, you would say this child's not retarded. And so this is a graph of the example I just gave you. And these are the two slopes, before and after. And I chose 4 more at random. You could see that the second slope here is quite a change from the first slope. Again. Are these results scientifically reliable? Okay, here's a dot plot of all the patients. This is before treatment. The slope is about 0.55, or what you might expect for Down syndrome. This is after the institution of the new treatment, 1.43. And here you can compare the groups, comparing each child before and after treatment. And if you look at the left curve, you could see that it peaks around, say, 50, and the right curve peaks around 1.4. There's a definite movement in the right. The right one is shifted to the right from the left one. So the right is shifted to the right. The motor median on the right is 1.2. The average is 1.4. So what we observe in this data is there's a substantial improvement in the rate of neurologic progress over chronologic age, basically doubling the rate of progress. All right, now hypothesis testing. Now, when we do statistical hypothesis testing, what we're trying to see is if these results could be merely luck or if something really happened. So if something really happened, the p-value is less than 0.05. So I'm going to use a paired t-test comparing each child to itself in a pairwise manner before and after. Before is the slope of progress up to the initial examination, and after is from the initial examination to the first follow-up. And the groups were normally distributed. So the standard treatment or before treatment is 0.55, after 1.43, and the difference is 0.87. If this treatment did not make any difference, this number should be 0, but it's not 0. And the 95% confidence interval certainly does not include 0. So the rate of progress more than doubled. There's quite a large number, N of 216, and the p-value is 10 to the minus 15th. So this indicates it's a reliable result. And in fact, when we have a number like this, it's hard to have an intuitive feel for what a number like this would mean. So if you would flip 5 heads in a row, that would be 1 out of 2 to the 5th power, or 1 out of 32. So if you could flip 5 heads in a row, you'd have a p-value of 0.03, and that would be good enough to publish in any scientific journal. If you would flip 10 heads in a row, now you could probably do this in 30 minutes with a little practice. If you would flip 10 heads in a row, you'd be lucky to get it done in a day. If you would flip 20 heads in a row, that would take you 1,000 days or 3 years. Flipping 30 heads in a row would take you 3,000 years. Flipping 40 heads in a row would take you 3 million years. And flipping 50 heads in a row would take you 3 billion years. So if you had come across a caveman, he would say, "Dr. Baggot made me flip these coins. I've been doing this for millions of years. I'm going to be doing this until the Cubs win the series 3 times in a row." And his friend would say, "Sorry, pal, you counted your zeros wrong. You're going to be flipping quarters until the sun freezes over." So there's a significant positive benefit, and it's a highly reliable result. Of the 3 cases that I showed you, the final IQs were 68, 71, 77, and 90. And this is the staff of the institutes that helped put the data together. And my research is funded by the Michael Fund, or International Foundation for Genetic Research. If you make a contribution, you'll get a tax deduction.
Thank you, Dr. Baggot.